Hi guys! It finally feels like summer here in Boston, so I want to talk about picking the perfect sunscreen. So what is the best sunscreen? The best sunscreen is one that you are actually going to use. Oftentimes I hear, I can't wear sunscreen because it makes me break out, because it gives me this white color, because it smells bad. If you're like my husband, it's because somehow you get it in your eyes when you're applying it. But there's really no excuse because there really is a sunscreen for everyone if you know where to look. Everyone can wear sunscreen with the exception of infants under 6 months of age, and those you should just cover up when you're outside. If you're just tuning in, I'm Dr. Abby Waldman. I'm a dermatologist at Brigham and Women's Hospital. My goal is to help you get as much information as you can on medicine, healthcare, and skincare in order to improve your life. If you're interested in getting more information on how to improve your life through medical knowledge, then hit subscribe. So I think that companies try to make sunscreen seem more complicated than it really is. So there are really only 3 golden rules of sunscreen that you have to follow. The first is it should be broad spectrum, meaning it should cover UVB and UVA rays. This is usually listed on the bottle as actually saying broad spectrum coverage, or it may say UVA/UVB coverage. So I get a lot of questions about SPF, and the main number to remember is 30. So SPF should be 30 or greater. You do get a little more coverage as you go higher than 30, but it's a matter of minutes, not hours. So, really, as long as you have a bare minimum of 30, that should be sufficient. However, there's no harm in having a higher SPF. No matter what SPF or what it says about water resistance on the bottle, you should reapply sunscreen every 2 hours or after swimming. If you have a particularly sweaty workout, you may also consider reapplying. So what are better, physical blockers or chemical sunscreens? So like I said before, the best sunscreen is the one that you're actually going to use. So whether you use a physical blocker or chemical sunscreen, it really comes down to what works for you. So let's talk physical blockers first. So physical blockers include titanium dioxide and zinc oxide. These are also known as mineral sunscreens. Physical blockers are kind of like wearing a coat of arms. So as the sun rays come down, they're deflected off like arrows. So the good thing and the bad thing about physical blockers is that they tend to have a white tint. So the nice thing is, especially when you're applying it to a toddler, which I know from experience, that you know where you've applied it, you know if you've missed a spot. That can also be the bad thing. Some people really don't like that no matter how much you rub it in, sometimes you can see this sort of very vague ghost effect of the sunscreen. That white color can be minimized by using a tinted sunscreen. So you can have a physical blocker with tint, and that can minimize that sort of white ghost effect. Another downside of using a physical blocker or a mineral sunscreen is that they don't quite provide as good sun protection as using a chemical sunscreen or a combination product. So I think chemical sunscreen should do a little rebranding because the word chemical in its name sends people running. So really all sunscreens are chemically derived, so it's a little bit of a misnomer. Chemical sunscreens are the majority of what you'll find on the shelves, and they've been around for ages. These sunscreens work by absorbing sun rays and preventing sun damage. Chemical sunscreens are generally easily applied. They go on light, they're absorbed easily. They don't give any sort of white ghost-like appearance. Chemical sunscreens can get a little complicated because their names tend to be long, very similar to each other. Often several chemicals will be listed under active ingredients on your sunscreen bottle, and that's because they generally will combine multiple sunscreens for best protection. So let's talk about chemical sunscreens. So the ones that have gotten a bad rap on the news are those that are considered estrogen or hormone mimickers. The most famous of these is oxybenzone, and 2 others to know about are octinoxate and homosalate. Oxybenzone and octinoxate are those 2 that are banned in Hawaii for disruption of coral reefs. So when should you think about avoiding estrogen or hormone mimickers? So if you have breast cancer or another hormone-mediated cancer, if you're pregnant or breastfeeding, if you're dealing with infertility, or if you're a small growing child, it may be in your best interest to try to avoid sunscreens that can act as hormone or estrogen mimickers. If you're just walking down the aisle at the drugstore trying to find a sunscreen, the easiest way to do this is to just pick one that says that it is safe for barrier reefs or that it is reef conscious. These sunscreens don't include oxybenzone or octinoxate. Even those listed safe for barrier reefs don't always exclude homosalate. There's more controversy on whether homosalate should be listed on these groups of endocrine disruptors. So again, use your best judgment if you're in this high risk group, if you're pregnant or breastfeeding. Sometimes you may consider just erring on the side of caution and just using a mineral sunscreen. So what if you have sensitive skin and you get outbreaks or rashes from wearing sunscreen? Most allergies are not due to the active sunscreen ingredients in sunscreen, and they're actually due to other additives. So if your issue is getting rashes or breakouts from wearing sunscreen, instead of going through every single ingredient on every single bottle in the store, I advise just going to this website called Skin Safe, and that will help you identify sunscreens that don't include common allergens or fragrance. Another quick way to find allergen-free sunscreens is to pick something that says it's for sensitive skin or is hypoallergenic. So if you have breast cancer or another hormone-mediated cancer, if you're pregnant or breastfeeding, it may be in your best interest to simply avoid parabens. Parabens are considered to be estrogen mimickers and endocrine disruptors. So one way to identify paraben-free sunscreen is to go onto this website, Skin Safe, and that will identify sunscreens that do not include parabens. More and more, sunscreens are actually putting paraben-free right on the bottle to make it super easy to pick one. So what about texture and smell? So I personally actually love the smell of sunscreen, but I guess that's why I became a dermatologist. This is really going to be a personal thing. You're going to have to look at reviews. You're going to have to try different products to find something that you like in terms of texture and application. So one good resource out there is Dr. Dre YouTube channel, which provides reviews of sunscreen. And I think other controversies that come up and I get asked a lot about for sunscreen is spray versus using a cream. And really, again, the sunscreen that you are going to use regularly is the best. So if a spray is what works for you, absolutely, I encourage that. One thing to know about the sprays is don't apply them directly into your face. You're going to get some really burning eyes because it contains alcohol. Same as my toddler tells me, if I spray it directly onto one of her boo-boos, then it hurts quite a bit. So just to be aware of. Another question I get asked about frequently is combination moisturizers and sunscreen. I think for that first application in the day, a combination of 30 SPF sunscreen plus moisturizer is great, and it gets you in the habit of just putting it on first thing in the morning. Later in the day when you're going in direct sunlight, it's good to reapply a full 30 SPF sunscreen directly. So hopefully some of these tips on how to pick the right sunscreen were helpful. Let me know in the comments about any sunscreen questions and concerns.